Hello and welcome to the Headache Doctor podcast, where it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to be talking about COVID-related headaches. When you have COVID, why do you have a headache? After COVID, why do you have a headache? If you have long COVID, why does that headache persist? Why do headaches seem to increase or change after COVID? What's the impact of COVID on headaches? Since we're a headache center and we see people that have COVID-related headaches or an increase in headaches related to COVID, we want to be able to answer these questions. The reason I'm bringing this topic to you is because it is very prevalent to have a COVID-related headache. To have headaches that persist after COVID is the specific sort of segment of people that we want to help here at Novera Headache Center. If you have COVID and you have a headache, there are probably things that we can do for you in the midst of COVID. But I would say for the most part, we'd want you to get better as far as not feeling ill. And then if the headache remains, or if you're someone that has suffered with headaches or migraines, if your symptoms of headaches or migraines increase, that's what we want to actually treat and address and talk about what is happening there. Why is the body responding? Why is your headache, why is your migraine responding in a negative way to this virus, which seemingly has little to do with your head or your neck? These things that we talk about on the podcast that seem to be triggers, the sources of the headaches or migraines that we talk about on this podcast, seemingly would have nothing to do with COVID. But what's fascinating is it actually does, there's a connection here that we're going to talk about. And so I think this podcast is going to be very helpful for a lot of people. First off, COVID, a few stats here. So according to the CDC, about 7.5% of adults were still experiencing persistent symptoms 3 or more months after their initial COVID diagnosis. So if you've experienced COVID, if you've had COVID, which most people have, 7.5% of you are experiencing prolonged symptoms. Maybe you've heard it referred to as long COVID or post-COVID syndrome. There's a lot of different sort of terms for it. But if you have symptoms that persist after the initial virus has run through your body, then that would qualify as in this 7.5%. Now, that could be anything from difficulty thinking, concentrating, the headache, sleep problems, dizziness when you stand up, pins and needles feeling, change of smell or taste, depression or anxiety. We've had patients that have some GI problems. We have patients that have numbness, tingling that wasn't there before. Another study that looked at 85 patients found that 20% of them still had headaches 3 months after being discharged from the hospital. So 3 months later, seemingly their body should have recovered. The virus is definitely not impacting them like it was when they were hospitalized. But 20% of these 85 people were still having headaches. And so we want to talk about that. We want to understand where these headaches are coming from, because if you're listening to this podcast or if you interact with someone who says, I had COVID and after COVID, my headaches started and they've persisted ever since. We've seen that, we've heard that, we've treated people that present like that. And so if that's you, this podcast is for you. But likely you will hear someone just talk about this, having COVID symptoms that persist, and one of those primary symptoms being a headache. And the message that I want them to hear, we're going to expand on this in the podcast, is that just because the symptoms started or changed because of COVID does not mean that treating COVID is the only line of action, is the only treatment approach that can be effective in reducing the headache. Okay? So, how people are experiencing their headaches in association with COVID. If you already have headaches, if you had headaches prior to COVID, there's a chance that the intensity or the frequency of those symptoms would increase. Now, if you have episodic headaches, if you have headaches that are sporadic, once a week, twice a week, every other week, whatever that frequency is, there's a chance that it could become just a chronic headache. It's there all the time. If if the intensity it was relatively low prior to COVID, it might increase. So there's some subtle changes that can be there if you had headaches prior to COVID, and then you just see them ramp up a bit after. Typically, it's a dull, achy headache that can persist. So it's that dull achiness. Typically, it's bilateral, so both sides of the head. You can be someone that did not have headaches prior to COVID and now has an onset of headaches after COVID, and those headaches can persist. They can also be intense, aggravating. A lot of people will or can describe their symptoms as migraine pain or like migraines. And so the COVID itself and what we're seeing with patients is it actually can be sort of a stimulus for people experiencing migraines. And so who is at risk? So people who in the past have experienced migraines are at more risk of developing a post-COVID headache. So if you are someone that's experienced headaches, migraines, if you've dealt with headaches or migraines in the past, you get COVID, you are at higher risk of getting that post-COVID headache. In addition to, people that have a history of headaches. Okay, so both migraine and headache sufferers getting COVID are at risk of getting this post-COVID headache. Okay, so that's important because what we're getting at here is not necessarily introducing something completely new that's now causing a completely new headache. It's introducing something that is impacting what was already there. Okay, that's important to understand. All right, so when we're thinking about this COVID headache, there's a couple things that we need to understand. But the primary thing is that we need to understand how the body interacts with inflammation and how inflammation impacts the body's threshold. So a lot of this conversation moving forward is going to it's going to circle around this idea of threshold. The threshold that everyone has, everyone's threshold is different. And if I'm going to define threshold, I'm going to say the point at which the body can no longer utilize a compensation mechanism to function without pain, or multiple compensation mechanisms to function without pain. So we're talking specifically in this context of headaches and migraines, and we're talking about threshold. So the assumption here is that your body is dealing with underlying tension. So people that have these post-COVID headaches, okay, that's who we're talking about. We're assuming that they have this underlying tension, this underlying neck problem, shoulder problem. They have an issue that would send pain into the head and result in a headache. But their threshold is high enough so that the body does not actually experience pain. They can function without pain, pain-free, okay? So just because someone is pain-free does not mean their body is perfect, or that there's nothing to address, or that there's no reason for there to be pain in the future. It very much has to do with threshold. Okay, there's a lot of things that impact threshold, which we're going to talk about. If you think about, if you go about your day, let's take a week snapshot, and from Monday on Tuesday, Wednesday, you have a seemingly normal day. You go to work, you go home, maybe you read, you watch some TV, you hang out with family, you eat a few meals, and then you go to bed, okay? Well, those are all pain-free. Well, then on Wednesday, you have your yoga class, and your yoga class forces you to put your body in positions that you realize, oh my gosh, I'm so tight, and I can't even move this way. And maybe there's some irritation in those positions, and they're hard to hold. So your body has basically been compensating in certain patterns where Monday and Tuesday you're fine, but on Wednesday when you try to get your body out of those compensation patterns, you start to realize that everything is not necessarily functioning as it should. You've just been compensating. All right? So when it comes to the threshold and people that have these post-COVID headaches, we have to understand that there was the underlying problem of tension that was there before they even got COVID. It's been there for who knows how long. all right? And we can assume that safely because life, like we've talked about in this podcast, life, whatever sort of trauma, gravity weighing down on us, the stresses of life, if those aren't combated, if we don't combat those really on a daily basis, then it's just going to build. That stress and that tension is going to build. I talk about that on the podcast where we look at, is perfection the goal? Okay? Because perfection is not the goal. It's just maintaining a level of activity and function. All right, the other thing to look at with threshold is not just the local amount of tension running through a specific area. In this conversation, we're talking about the neck and the shoulders, but it's also systemically. So you have the local factors, which is the amount of tension, and then you have the systemic factors, which would be like the amount of inflammation that's running through your entire body. Hormonally, what is impacting all these systems in your body that might be playing into how much pain or how much of that local tension your brain is able to deal with. But the big one for this conversation is going to be inflammation. An example of this is sugar. Glucose is highly inflammatory, so excess levels of glucose, large amounts of glucose in the body, can be a trigger for a lot of people. I have several patients like this currently where if they have cake and ice cream after a meal or at a party, and maybe they drink some Coke or something like that, they will very likely wind up with a headache or a migraine, whether it's that evening or the next day. And all they're dealing with there is their body responding poorly and it presenting as a headache or migraine, but their threshold drops because of that inflammation, the response to the sugar. And so they're not impacting their neck, they're not impacting their shoulders necessarily, they're impacting the systemic influence of inflammation that impacts their body's threshold. And as that threshold drops, it drops below the level of tension. And so think of it this way, you've got a line of tension, all right? You've got a line of tension, and then you've got a line that is your threshold. If your threshold line is above the tension line, you're good. There's no headache. There's no migraine. If the tension line goes above the threshold, or if the threshold line drops below the tension line, and there's that delta there, that's when you have a headache. And if it's a substantial delta, that's when you have a migraine. This gets into all the different sort of elements of headaches and migraines, the triggers that people will go and pursue to try to solve their problem. When really the whole time they just need to understand thresholds, and addressing the underlying problem is very likely the neck or their shoulders. And in addition to that, all those things that impact their headache or migraine experience are the triggers. All right, so hopefully this idea of threshold is starting to make sense for you. Let me recap it one more time. There's two things that can impact threshold. The first is the local tension, the amount of irritation. So let's say like muscles, tendons, the joints themselves that are irritated and sending that pain signal. So that's the first thing. And then in addition to that, it's systemic. So systemically, inflammation. So let's bring this back to COVID. When it comes to COVID, there's two things that we need to consider. When someone has COVID and they're sick, first off, you're probably sitting or laying down, so you're more sedentary. And we know that lack of movement can be irritating to the neck, to the shoulders, especially if those sedentary positions have your neck in positions that are adding stress. So these little joints inside the neck, these little muscles, they're trying to hold your head up throughout the day. They're trying to do these proper movements. And if we don't let them do those throughout the day, they get irritated. Now, we're assuming they're already irritated, and there's already some sort of tension there for people that are then getting COVID. And when they get COVID, they're even more sedentary, and maybe they're coughing, and they're having to sort of pull in all these neck muscle groups and extra expiratory muscle groups into their shoulders and their neck that then increase the amount of tension through their neck, causing them to have even more stress through this area. So the increase in stress during COVID is a very real thing, and that could be part of what's happening. But I think for the most part, what people are experiencing when they get post-COVID headaches is more so this idea of the inflammatory response that we have naturally in our bodies in response to the coronavirus that continues after the actual sick period that we have COVID. So those symptoms continue because there's a sense that our body is still dealing with something. And so there's a low level of inflammation that is dropping our threshold. So that inflammation drops the body's threshold. Potentially there's some increased amount of stress or tension in the neck. And what that does is that causes people to have these headaches. They start to realize that my neck hurts or my shoulders hurt, and it manifests as head pain. Now, so what do we do about that? What do we do about the inflammation in the body? Or what do we do about this headache? Because oftentimes these headaches are, they're very aggravating for people. They have a hard time working, they have a hard time focusing. If they had headaches or migraines previously, maybe they've ramped up to a level where they're no longer manageable, and so they need to be treated. Well, there's two things we can do. The first is to actually address the source of tension, the actual pain generator. Okay, so this means that we look at the neck, we work on the neck, we reduce the amount of tension through the neck and your shoulders. Wherever there might be a source of pain that's sending it to your head, we want to address that, okay? Because regardless of how much inflammation is running through your body, if your neck has no reason to be sending a pain signal, then you won't be having this sort of headache neck issue, okay? So if in theory we can completely remove the underlying tension, that's one way out of this, okay? Now, typically with our patients, we don't necessarily have to completely remove the amount of tension. We just have to get it low enough so that it then drops back below that level, that threshold line, and then you no longer have headaches. And then we have to teach you how to manage it and take care of that. I've actually had patients who've successfully gone through treatment for their migraines, then they get COVID and their migraines come back. And all we do is we look at their neck and we have to dive even deeper to keeping their neck in good, healthy condition because their threshold did drop. But we don't change what we do. We just have to continue to make sure there's no reason for their neck to be sending that pain signal. Now, the second thing you can do is to actually address the systemic inflammation portion of it. Now, that is not something that we would do here at Novera. We would work with providers like Dr. Nathan Morris, who I've interviewed on this podcast. He's a functional medicine doctor. And these are doctors that understand inflammation very well. And he's actually taken people through a series of supplements, diet, different sorts of interventions that help them manage their inflammation. And so managing the inflammation is also an avenue that you can go down. So we've had several patients with post-COVID symptoms, and those are the two approaches we take. If you have headaches, if you have any sort of like physical pain or issue that we can work on here at Novera, we want to do that. But in addition, we want to make sure we're addressing the inflammation issue, which is going to look more like functional medicine, seeing Dr. Nathan Morris, someone in that category who understands inflammation and can actually treat that effectively. This idea of chronic inflammation is something that oftentimes our Western medicine approach has a hard time dealing with. And we, as a whole, just don't want people to be on medication long term. Short term, if it has to be at all. But we want to get to the root of the problem. So finding a provider that can help you solve that root of the problem is who you need to be working with. All right, so there you have it. COVID-related headaches are still very, very likely. It's a very, very high likelihood that your neck is a problem, that your shoulders are a problem, even if you did not have headaches prior to COVID. This is a new onset of headache after COVID. Your neck was likely an issue. You didn't realize it because your threshold was higher. Your threshold's now dropped. Potentially the level of tension in your neck has increased. And now you're at a point where you're starting to experience headaches. The best way out of that is not by taking medication, but rather by treating the actual problem in your neck or your shoulders and then reducing the amount of inflammation. And that's our two-pronged approach for people that have COVID-related headaches. And if that is you, we definitely want you to reach out to us here at Novera Headache Center located in Colorado Springs. If you are virtual, we also have a virtual coaching option and a virtual course that we can help you through. And then sort of put a framework in your mind of who you need to be working with so that you can also find the relief that you're looking for. Thank you so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear and dependence and thrive in everything you do. Thanks for listening.